Listen closely. What I'm about to share could potentially save your life. Every time you use the bathroom, your body is sending signals, but most people simply flush and move on. They don't realize their body may have been trying to warn them, and that oversight can be dangerous. I understand this may sound alarming. I'm Dr. Michael Kent, and I want to be clear about something. I've witnessed this situation far too often in my practice. People overlook early warning signs. They assume everything is fine. Then one day, they're diagnosed with cancer, and by that point, it's often advanced. Here's a reality that isn't discussed enough. Your stool acts like a report card for your health. It reflects what's happening inside your body. The color can indicate how your liver and pancreas are functioning and whether there might be internal bleeding. The shape can reveal if there's a blockage in your intestines, including something as serious as a tumor. But here's the concerning part. The most dangerous type of stool can appear almost normal at first glance. You might look at it and assume everything is okay, while something harmful could be developing internally. That brief moment when you glance into the toilet before flushing, it may feel awkward, but it can be life-saving. Today, I'm going to explain exactly what you should watch for. I'll identify which type of stool may signal the greatest risk, and I'll clarify when it's critical to seek immediate medical attention. But this isn't about creating fear. It's about giving you practical guidance, simple steps you can take right now to protect your health, approaches that can help even if you're on medication, have limited mobility, or are managing on a fixed income. The final two insights are especially impactful and could significantly improve your health within just a few weeks. But first, it's important to understand one key point. Most people don't actually know what healthy stool looks like. It's rarely discussed or taught. It can feel uncomfortable or unpleasant to talk about, so it's often avoided, but ignoring it can be a serious mistake. Let me explain this as simply as possible. We doctors use a tool called the Bristol Stool Chart. You can easily print this chart online and place it inside your bathroom cabinet. Just search for the Bristol Stool Chart and print a copy. It ranges from number 1 to number 7. Number 1 looks like small, hard pellets, similar to rabbit droppings. Number 7 is fully liquid, like water. Here's what matters. Your stool should be brown in color. It should be soft yet formed, similar to a sausage. Not too hard, not too watery, just smooth and easy to pass. When it appears this way, your body is functioning properly. But why is it brown? Because your food combines with a substance called bile. Bile begins as green, and as it travels through your digestive system, it turns brown. That brown color signals that your system is working correctly. Ideally, you should have a bowel movement once every day, or at least every other day, and going at a consistent time each day is even better. If you're going less often than this, or if you suddenly notice a big change in how often you go, that's a warning sign. Now let's talk about something more serious. Healthy stool should have a normal thickness, about the width of your thumb, maybe slightly wider. If your stool becomes thin, like a pencil or a flat ribbon, something may be compressing it. There could be a blockage in the pathway. In some cases, that blockage could be a tumor. This isn't meant to frighten you unnecessarily. It's important because many people are unaware. They notice thin stool and assume it's just constipation. They wait, hoping it improves. But if it is cancer, it can continue to grow each day. If you notice pencil-thin stool more than twice within a week, contact your doctor's office the next morning. Don't wait for a routine visit. Tell them you need an appointment soon due to changes in your bowel habits. That will help them understand the urgency. Now, here is one of the most serious warning signs. If your stool appears black, very black, like tar or coffee grounds, stop and act immediately. This is an emergency. Stool like this often means internal bleeding. Somewhere in your stomach or intestines, blood may be present. When blood stays in the intestines, it turns black. This could be caused by an ulcer, damaged blood vessels, or even cancer. The critical concern is this. If there is enough blood to turn your stool black, you could be losing a significant amount of blood. your health may be at risk. If you ever see black, tar-like stool, call 911 or have someone take you to the emergency room right away. Do not wait until the next day. Do not wait to see if it happens again. Treat it with the same urgency as chest pain. There is one important note. Certain medications, such as iron supplements or Pepto-Bismol, can also darken your stool. However, there is a difference. Stool affected by medication may look darker, but tends to appear more grayish. Stool caused by blood is usually shiny and sticky, resembling tar. If you are unsure, it is safer to seek medical care. Another warning sign is visible blood. If you notice bright red blood in your stool, on toilet paper, or in the toilet water, take it seriously. Sometimes the cause is hemorrhoids, which are not severe, but other times it may be due to polyps or cancer. The issue is that you cannot determine the cause just by looking. Here's what you should do. If you see a small amount of bright red blood once, contact your doctor within a few days. If it happens more than once, or if there is a larger amount, call your doctor the same day. If you see blood along with symptoms like dizziness, weakness, or extreme fatigue, treat it as an emergency and go to the hospital. Do not ignore it. There are additional signs to watch for. If you are having bowel movements much less frequently or much more often than usual, something may be wrong. Constipation lasting longer than 2 weeks needs evaluation. Diarrhea that continues for more than 4 weeks may indicate a serious intestinal condition. Possible causes include parasites, inflammation, or even cancer. Many people are also unaware that common medications can lead to constipation. Blood pressure medications, pain relievers, antidepressants, iron supplements, and calcium can all slow bowel movements. If you started a new medication and then developed constipation, inform your doctor. In some cases, they can prescribe an alternative that does not have this effect. Never stop taking your medication without medical advice. Your concerns. Now, I'm going to share 5 key strategies to help protect your health. These are simple steps I regularly discuss with my patients, but they are highly effective. I will also explain exactly how to follow them, even if you are dealing with common challenges many seniors face. Secret number 1 is to move your body every day. If you sit all day, your intestines can become sluggish. They stop functioning properly. But here's the encouraging part. You don't need intense exercise. Even light activity can help. If you're able to walk, try walking for just 10 to 20 minutes daily. This can be inside your home, around your yard, or even at the mall. If you use a walker or a cane, that's completely fine. The goal is simply to stay active. If walking isn't possible, you can still support your intestines. Sit in a chair and lift your legs up and down for 5 minutes. Try arm circles or gently rock from side to side. Any type of movement signals your intestines to wake up and function. The ideal time to do this is in the morning, right after breakfast, as it helps stimulate your bowels for the rest of the day. Secret number 2 is to stop eating junk food and begin choosing foods that support your gut health. This is important. Items like chips, cookies, frozen meals, packaged snacks, and hot dogs are harmful to your intestines. Processed meats such as sausages, bacon, and deli meats are linked to cancer, and research supports this. You might be thinking that healthy eating is expensive, but that's not true. There are many affordable, gut-friendly options. Bananas are inexpensive, often around 20 cents each. Apples are affordable, especially when they are in season. A large container of oatmeal costs about $3 and can last for 2 weeks. Carrots are among the most budget-friendly vegetables. Canned beans are usually under $1, and eggs provide low-cost protein. Brown rice is also very cheap per serving. Frozen vegetables are just as nutritious as fresh ones and last longer. You don't need expensive organic products, just real simple food, food your grandmother would recognize. Here's a helpful rule. If a product comes in a box or bag and contains more than 5 ingredients you can't pronounce, it's best to avoid it. Let me share a simple and affordable meal plan that supports your gut. For breakfast, you can have oatmeal with sliced banana and a bit of cinnamon, or scrambled eggs with cooked vegetables. For lunch, try bean soup with carrots and onions, or a sandwich made with real turkey or chicken, not processed meat, along with lettuce and tomato. For dinner, consider baked chicken with brown rice and steamed frozen vegetables, or fish with a baked potato and a side salad. For snacks, choose an apple, some carrots, or plain yogurt. Drink water with every meal. Eating this way doesn't increase your costs. In many cases, it's cheaper than eating processed food, and your gut will benefit. Secret number 3 is to eliminate parasites once a year. You may believe you don't have worms or parasites, but many people do without realizing it. These organisms take nutrients from your body, cause fatigue, and may lead to diarrhea or constipation. In some cases, they can contribute to serious health issues. Medication used to treat parasites is generally affordable and safe, often requiring just 1 or 2 doses. Speak with your doctor during your next visit and say, "I'd like to take deworming medication as a precaution." Most doctors will provide a prescription without difficulty. A single dose can offer protection for the entire year. If you have pets, this step is especially important as animals can transmit parasites to humans. Secret number 4 is to get a colonoscopy after age 50 or earlier if you experience symptoms. While it may not be appealing, the preparation can be uncomfortable and requires staying close to a bathroom. It is a crucial test. Colonoscopy screening has saved many lives over the years. Colon cancer often shows no symptoms until it reaches an advanced stage. This test can detect cancer early when it is small and easier to treat. It can also identify and remove polyps before they become cancerous. If cost is a concern, here is important information. Medicare covers colonoscopy screenings at no cost for individuals aged 65 and older, meaning no copay. Many other insurance plans also cover it. If you don't have insurance, hospitals often provide payment plans or financial assistance programs. Call your hospital's billing office and ask about financial help. Don't let cost prevent you from getting this test. If you feel nervous about the procedure, speak with your doctor. They can provide medication to help you stay calm. Most people report that the preparation is harder than the test itself. Many don't remember the procedure because of the medication. Now, here is the most important tip. Secret number 5. Take care of your gut bacteria every day. Inside your intestines live trillions of tiny helpful bacteria. These good bacteria act like a defense system. They help break down food, fight disease, and produce essential vitamins. They even influence your mood and energy levels. When these bacteria are balanced, you feel well. When they are reduced, your body suffers. You may feel tired, get sick more often, and struggle with digestion. Frequent use of antibiotics for minor illnesses can destroy these helpful bacteria. Eating unhealthy foods can also harm them. When good bacteria decrease, harmful bacteria can take over, leading to illness. So how do you support these beneficial bacteria? Here's what to pick up at the grocery store. Choose plain yogurt, not the kind with added sugar or fruit. Look for labels that say live active cultures or probiotics. Brands like Danone, Yoplait, or even store brands are fine, as long as they contain live cultures. Eat about half a cup daily. If you prefer a sweeter taste, add your own fruit like bananas or berries. If available, kefir is another great option. It's similar to drinkable yogurt. You can also buy probiotic supplements at the pharmacy, but getting them from food is often more affordable and just as effective. A large container of yogurt can cost around $3 and provide a week's supply of probiotics. In addition, you need to nourish these bacteria. They rely on prebiotics, types of food your body doesn't digest, but bacteria thrive on. Here are some good choices. Bananas that are slightly green rather than fully ripe. The greener they are, the more beneficial. Apples with the skin. Avoid peeling them since the skin contains key nutrients. Oatmeal or oat bran, ideally eaten daily. Onions and garlic, which can be added to many meals. Beans such as black beans, pinto beans, chickpeas, and lentils. Whole grains like whole grain bread or brown rice instead of white versions. These foods are affordable and help your gut bacteria stay strong. When your gut health improves, your overall health often improves as well. You may notice better energy, improved mood, fewer illnesses, and smoother digestion. It may seem surprising, but it's backed by science. Here's something simple to start today. Each time you use the bathroom, take a few seconds to observe before flushing. Keep a small notebook nearby. Write down the date and what you notice. Is the color brown? Is it soft but formed? Was it easy to pass? This takes only a few seconds, but creates a helpful record. If something changes, you can share this information with your doctor, which makes your concerns clearer and more credible. Ask yourself these questions regularly. Is it brown? Is it soft but shaped like a sausage? Does it pass easily without strain? Am I going at least every other day? If you answer yes to all, you're likely on the right track. Continue your current habits. However, watch for warning signs. Black, tar-like stool. Go to the emergency room immediately. Bright red blood appearing more than once. Contact your doctor the same day. Very thin stool occurring multiple times in a week. Call your doctor within a few days. No bowel movement for more than 2 weeks. Seek medical advice. Diarrhea lasting more than 4 weeks. Consult your doctor. Any sudden change lasting over a week, report it. There's no need to feel embarrassed. Doctors discuss these issues regularly. It's part of their work and they need accurate information to help you. Also, when calling your doctor's office, you may first speak with a nurse or receptionist. If your appointment is scheduled too far out and you're concerned, clearly state, "I'm experiencing red flag symptoms. I need an earlier appointment." This phrase signals urgency and can help you be seen sooner. Your body communicates with you daily through your bowel habits. The key is paying attention. Don't ignore early warning signs or delay action. Many problems are easier to treat when caught early. Start making small changes today. Print a Bristol stool chart. Keep that notebook in your bathroom. Add yogurt and bananas to your shopping list. Take a short walk after breakfast. Schedule a colonoscopy if you're due for one. These simple steps can improve your health and potentially extend your life. Your loved ones rely on you, and you deserve to feel well. So beginning now, pay attention to your body's signals. It could make a significant difference. I'm Dr.